It is Sunday the 3rd of January and you are very welcome to this video. Lots to get through today, but one thing, the bottom line of this video actually is things aren't going too well in the United States and the United Kingdom. That's the bottom line if you haven't got time for the whole video today. But one thing that's been annoying me lately is I've watched all these people on video going for the vaccination, and they're kind of trying to roll up a shirt from under here. And it's just not working. Now, it would save lots of time if people dress in something loose, because what you want to do an injection, an intramuscular injection into the deltoid, is to be able to get that wants to be right above, so that's above the joint of your elbow like that. And that gives access to the deltoid muscle up here. So if you put your hand on there and move your arm, you can feel the deltoid muscle pulling. And that's where you want to go. You want to go into the body of the deltoid muscle right up here. And if someone has got a poorly developed deltoid muscle, you can just sort of bunch it up and put it in. So that would speed things up a bit. It's into the body of the deltoid, high in the deltoid there. Not down here in the thin bit. That's where it wants to go. So makes it much easier if you do that. So just something that was irritating me, so excuse me for putting that on. Now, how are we doing with the vaccine globally? Now, I've got an interesting site here I want to share with you. I'll put the link on. It's the first thing in the description. So do have a look at it for yourself. And more than 12 million shots given COVID-19 vaccine tracker. So 12 million doses in 30 countries so far. 4.8 million doses have been given out in the United States. Now, this is actually pretty pathetic. We were expecting about 25 million doses by now in the United States, so it's not the blistering start we'd hoped for. I am optimistic it will accelerate. It certainly needs to accelerate big time and fast. We need to really get going on this. But there's a tracker here which is quite useful. So, and it's one of these lifetime ones. It never ceases to amaze me. So Montana, you see, is doing quite well. 2.15% of the population, 23,000 people. But lower population state, of course, makes it slightly easier. When you look at the higher population states, California, not doing quite as well. So have a look on that. Very interesting. And also, it's got global matters as well on this. So, for example, if we check how the UK is doing, we've done 1.42% of the population, given out 947,000. Not yet a million. We're not doing as well as we're not doing that well here either. I'd hope for a much quicker rollout than this. And I'm disappointed about the delay with the Oxford vaccine as well, which doesn't start till tomorrow. More on that later. So China, we know, has been domestically and distributing to the military for some time. We know that Russia's made a start. Canada, I must say, I'm surprised at Canada. I thought Canada would be better on. Portugal made a start. Germany. Of course, the whole European Union situation, they had a very slow start because the European Medicines Agency weren't going to meet to the 29th. Eventually, they met on the 21st. But they've been a bit tardy about this, to be quite honest. The more proactivity needed, I really feel. Let's just check one more country, France. Now, according to this, France has vaccinated 352 people. So, not 352,000, 352. Absolutely unbelievable. Essentially, no percent of their entire population. What is going on? Why haven't they made a blistering start here? Did they not realise this is an emergency situation? Anyway, that's the report. So do look at that, and as long as that's kept up to date, and it appears to be. I'm certainly planning to follow that. It does seem bang up to date. Israel, leading the pack by far. 10.5% of the population already vaccinated in Israel. And I think Bahrain's doing quite well. I don't know if we can catch Bahrain there. It's probably a bit little for my mouse sensitivity. There we go. Well, again, it's not. That's Oman. Sorry, it's not Bahrain. Yeah, that's it. Bahrain. I knew Bahrain had made a good start. So 4% of the population. So good start. But Israel doing particularly well at the moment. So anyway, something to keep an eye on. I do stress this is not a race. I probably used inappropriate terminology there. It's not a competition. We just need to get this done because people are suffering and people are dying. Now, coming on to the detail that I wanted to talk about today. So that's that vaccine tracker app. It's the first thing on the description. So click on it, keep an eye on it. Interesting, and it appears to be completely up to date. The United States, the cases, of course, are increasing. Now, we still haven't got the full data. This is something else that seems to be... I've heard reports from all over the States about this, that, a lot of people have been taking a holiday over Christmas and New Year. People that would normally be providing healthcare. Now, I hope you caught Carly's video yesterday, the heroic effort being made by many healthcare providers. But some sectors just don't seem to get what an emergency we are in. And that's reflected in the data from the States, which is still delayed, as we see here. So the number of cases is up. So that's Thanksgiving. That's Christmas / New Year. And we're still not back up to the numbers, because this is not the numbers here, as we're going to look at the more correct numbers in a minute. But we do see that deaths in the United States are really... The trend is very much up. Unfortunately, it's not good. Anyway, getting back to these numbers. So that's the numbers officially diagnosed with tests. That number's up 7.5% in the past week. Hospitalisations now, 123,000 people in hospital at the moment. 23,000 in intensive care, just under 8,000 currently being ventilated. Glad to see the ventilator numbers are relatively low, because we know that's associated with a poor prognosis. Deaths, of course, continue to climb, now 341,000 deaths. That's the Centre for Disease Control site I've showed you. Check on the US official hospitalisation sites. But this is from the American COVID tracker site, so I'm happy that these are as reliable as we've got. And that site is that one there. All in the description, of course. If what I say doesn't relate to evidence, you can ignore it. Now, in the United States, they've sequenced 51,000 viruses. Now, in the United Kingdom, we've sequenced 140,000 plus for a smaller population. So the sequencing in the United States has been really very, very poor, very patchy. Only 51,000 sequenced. Now, this is the mutation that occurred in South Africa. This one's now called B1351. And we believe this is more transmissible. Now, is this in the United States at the moment? Well, we simply don't know. The sequencing has not been done. We simply don't know that. Maybe it is, maybe it isn't. Let's hope it's not. The United States, now this is the variant that we called the Kent mutation, after the place it was first discovered in the UK. The B117, as we're now calling it. That is in the United States, and we know that now. And we know it's been found in Colorado. And I did check on this just before I came on to do this video this morning, and it still hasn't changed. Colorado, California, and Florida are all the documented cases that we have at the moment. Is it in other places? Yes, it is. Almost certainly, but we really don't know, because the sequencing is not being done. The Florida case, though, was a man in his 20s, no recent travel history. And the cases in California and Colorado, also there were cases with no travel history, which means it was community acquired. This is spreading a lot. Now, the CDC is scrambling, it has to be said retrospectively. In my view, a definite lack of proactive thinking from the CDC to greatly improve their genomic surveillance now. And that will be done. But the question is, we're a year into this pandemic now. Why has it been done before? We know this virus mutates. We knew these mutations were going to occur. We're disappointed how transmissible this new British one is. The one that was first identified in the UK, the B117. But as we've said many times, did it arise in the UK, or was it first identified in the UK because we're doing the highest number of genomic testing? And as well as that, the PCR test that we're using in the UK just happens to detect it. So we've been able to track it. So in my area, for example, we know at the moment 75% of cases in Cumbria are this new, more transmissible variant. This is a big problem. It's making a massive difference. But at least we know that. So partly we know it because our PCR test happens to pick it up so we could track it, whereas the US PCR test doesn't pick it up. So it's partly good luck that we've been able to track this. But it's also, anyway, we've said enough. The CDC is improving its genomic testing. Better late than never. But at the moment we are sloshing around in a lot of ignorance in terms of the new strains in the United States. Now, moving on to the UK, I'm just going to show this graph from the COVID symptom tracker app. We'll come to that in a minute. So these are symptomatic cases, underestimate, of course. 63,800. That means there's about 80,000 new cases in the UK symptomatically today. Let's not put too fine a point on it. I don't want to be melodramatic, but this is a national crisis now. This is the worst it's ever been. I'm concerned. People around the country are concerned. I'm not pretending it's otherwise. It's not good just now. Anyway, no, let's stick with the app for now. So that's the number of new cases. And by the way, you can fill out the COVID symptom tracker app. Look for that logo on your phone. What do you call it? Your appy thing. Your what do you call it? It's that Play Store or whatever it is. That thing you go to download apps. It's like if you're in the States, it's in there. Download it. Start tracking every day. The more people that do this, the better. The UK is about 1 million people doing it now, which is pretty pathetic, really, that people just aren't more actively involved in this. But wherever you are, see if you can download that app. The United States and Canada, for sure, you can. It gives us all this really useful information. So they're the new cases, geographical distribution. But this is the prevalence, the people with it at the moment. And we can see that the space between these daily figures now indicating this rapid rise. So 2nd of January, they're estimating 672,000 people with the virus in the UK at the moment. That is live time, or yesterday's, but as good a prevalence as we can as we can get. So yeah, there we go. So United Kingdom. So that's that app there. Check on it for yourself. Excellent app. Cases, official data. This was data from Saturday. No, that was from Friday. Sorry, that was from Saturday. 57,000 cases on Saturday. So that's Friday the 1st. That's Saturday the 2nd. So well over 2.5 million officially diagnosed cases. Hospitalisations, an extra 2,434. This is not sustainable. It's as simple as that. That's 23,000 people in hospital now. Ventilated, we believe, 1,800. Unclear whether that's ventilated or intensive care. I think that's probably more in intensive care. Anyway, the hospital numbers are going up dramatically and are now way higher than they were at the peak in April the 12th, the peak of the first wave. Vaccinated 600. No, that's wrong. It was 900,000 now. Sorry, that's out of date. So it's nearly 1 million now. It was 950,000, wasn't it? Vaccinated in the UK. Deaths unfortunately continue to rise. That was the figure for Saturday. That's the figure for Friday. These are the deaths that are diagnosed within 28 days of a positive test. These are the deaths that are mentioned on the death certificate, but this is only updated weekly, so that is a bit out of date now. But it's the latest we have on the government site. Oh, there we go. I've updated the vaccinations there. That's the update there on the official government site at the moment. And of course, I know a lot of you watched that video yesterday on the moving from the giving a few people 2 doses to giving many people 1 dose. Professor Andrew Goddard, President of the Royal College of Physicians, so one of the boss doctors in the country. Hospitals across the UK should prepare for London levels, unfortunately. So in London, hospitals are under severe strain, and he's saying this is going to be the same in the whole country pretty soon. Case numbers will increase, he is saying, next week. Case numbers were mild compared to where they would be in a week. Things are getting dramatically worse in the next week, he is saying. Doctors are really worried. You know, when senior people like this, you know, if you're watching in the States, you probably realise that in the UK we tend to understate things. So for someone of this calibre, in this sort of position, to be talking in these kind of terms is really quite a significant thing in English culture, that someone would talk in these terms. Almost half of the major hospital trusts in England are dealing with more COVID-19 cases than at the peak. That was the 12th of April. NHS is having its busiest winter ever. There's no doubt that Christmas is going to have a big impact. We're going to get a Christmas surge, unfortunately. The new variant is also having a big impact. It is about 55% more transmissible. So the R value is now much higher with this new strain. We know that it's more infectious, more transmissible. Not me, that's a direct quote from Professor Andrew Goddard. We know that it's more infectious and more transmissible. This is the situation we are now in. So I think the large numbers that we're seeing in the southeast and London, South Wales, is now going to be reflected over the next month, 2 months even, over the rest of the country. This is a countrywide problem. London's Nightingale Hospital, the emergency hospital, is being ready to admit patients. We know this is a large hospital. We know it's well equipped, but who the heck are we going to staff it with is going to be the problem. That's going to be the difficulty. Other sites currently not in use are being readied, so we are preparing for more. Dr. Jones, intensive care consultant, when we see the daily figures, we know that it'll sting us in about 10 to 12 days' time. This inevitable feedback, the percentage of people from the people being diagnosed now, that's going to feed through into poorly people in the next couple of weeks. Stop mixing with other households because it's spreading like wildfire. Again, senior people in official positions don't normally use this kind of terminology. This is quite extreme to use analogies like wildfire. We haven't got much more space in the hospitals left. Now, there's been a big debate in the UK about schools, and I've been challenged to come out on it, which I'm now going to do. Basically, I think all schools need to close for the next couple of weeks. It's that simple. It's a bit of a no-brainer, really. I'll give you some reasons for that. National Education Union, this is the teachers' union. Basically, they want everything shut for a couple of weeks. Now, I don't agree with them on everything, but I agree with them 100% on this. It's already happening in junior schools in London. It's a bit patchy, but rising cases in secondary school age groups. Now, this is the unknown. Now, let me tell you what we know. We know there's a rise in cases in secondary school age group children, under 18s, young adults, older children, adolescents. There is an increase in the number of cases. Some people are suggesting that the new variant is infecting young people more readily than the old variant. Now, we haven't got enough data to test that yet, but there is anecdotal reports. We haven't got official figures that there are more young people getting sick. Now, still, thankfully, massively more than older people. But is this new variant turning out to be more transmissible? Well, certainly more transmissible in younger people and children. Is it turning out to be more virulent, causing more diagnosed infection in younger people? It may. We don't really know yet. But given that that is a real possibility, there's no question that we need to close schools for a couple of weeks. It's political, it's to do with social control. Education can be caught up with, that doesn't worry me at all. It's going to cause havoc to parents going to work and all sorts of things. But I think we're in an emergency situation now and that needs to be done. So that is my view on that. Mass testing in schools is what the government perceives as a way out. To tell you the truth, I'm not buying this one. The mass test, the lateral flow tests, we know that they're not accurate. We know that teachers don't like doing anything medical. They're not doctors, they're not nurses, they're teachers. In fact, I would say that teachers are kind of medical phobic. I'm not saying it's their fault. There's so many litigation and problems if they give medical interventions, which is why we have school nurses in a lot of bigger schools, of course, to do this kind of thing. But is the mass testing the way to go in schools? I really don't see that as a way out. I really don't buy that one. I think there would be too many false negatives to make it viable. Again, just my view. It's not the government position. Let me stress that. But I don't really see mass testing as... I think everyone would agree it's not a panacea for schools. Now, let's move on to France. So, as we've seen, France has vaccinated a few hundred people out of a population of 67 million. It works out at 55 vaccines a day. So, this is just hard to believe. The French nation has managed to vaccinate 55 of its citizens every day. How can this be? Email from a source in France, Anthony. He said the Oxford vaccine is simply not in the press. People aren't talking about the Oxford vaccine. Why not? The European Union have got 400 million doses of the Oxford vaccine on order. Enough to transform the situation, and yet it's not being talked about in the French press. So Anthony said there's a marked lack of mention of the Oxford AstraZeneca vaccine. We only hear about the Pfizer Moderna vaccines. We know the efficacy is good, but we also know about the cold chain problems. Apart from the pro-vaccination sector, who will imply an ill-timed element of narcissistic tendency by the government, with a hint of sour grape Brexit thrown in for good measure. In other words, the French are, what's the expression, annoyed, irritated about the recent political changes. Okay, that's an opinion, but in Anthony's view, this seems to be affecting their response and possibly their response to the Oxford vaccine. Someone's commented, at times like this, we need to stop being French and be grateful that the United States, the United Kingdom has given us vital options. So Anthony's seeing problems there in the French response. Anthony lives there, has done for some time. So I do know who Anthony is. Now the Oxford vaccine, why it's not being rolled out is just a complete mystery. Why aren't the European Medicines Agency acting on this? What needs to happen? And the 27 member states, and I'm not making a political point. I wouldn't do that. But the 27 member states, the European Medicines Agency is simply not acting on the Oxford AstraZeneca vaccine. Therefore, individual states need to. So the German Robert Koch Institute, or whoever authorises it in Germany, needs to authorise it to get on with this. That's what we did in the UK. Now, the UK, when the UK authorised the Oxford AstraZeneca vaccine weeks ago, that we were still bound by European Union regulations. So it wasn't, a lot of people on the pro-Brexit campaign of saying, Britain's now free and nimble to do all these things. No. That rule, we were still following European law. It was the law of the land in this transition period. It was just that the UK government decided to act independently. And I don't see why Germany and France and Italy and Spain shouldn't do that and bypass the European Medicines Agency. I don't know, but the European Medicines Agency have not authorised this yet, and they're in an emergency situation. And as far as I know, it's not actively being considered. I just don't get it. So individual nation states, it seems to me, need to go alone on this. Illegal rave in Brittany lasted for 36 hours. How on earth do you rave for 36 hours? I would need to go to bed after the first 10 minutes. 2,500 people attended. Well organised, food stalls in there. People from the UK and Spain went as well. I've seen the pictures. People dancing, close physical contact, young people, alcohol, working out for yourself. No mask wearing that I saw on the videos. Absolutely unbelievable. This is an outbreak of mass insanity. There's no other way to describe it. Only it's not mass insanity, it's mass callous I don't care about other people outbreak. Police were injured. As people were leaving the event, some of them were fined, by no means all of them. And the French authorities urged them to self-isolate. Urged to self-isolate for 7 days. Well, I'm afraid if I'd been in charge, I would have probably put a fence around it and enforced the isolation. So basically, we've got people from this rave in Brittany. Some seem to have some gone back to the UK. I don't know. Have some gone back to what was the other country? Spain. Maybe just drifting across Europe. While the rest of France is suffering under a curfew, this complete breakdown in law and order. It really is. We talked about the national disgrace of the British tourists in France, in Switzerland. It was a national disgrace that British people would behave in that way. Well, the French have blotted the copybook on this one. Not enforcing that is just the fact that people would do it, and then the fact that it wouldn't be enforced when the authorities knew about it makes a mockery of law and order as far as I can see. But there you go. India, 2 vaccines have been approved by the Drug Control Central of India. That's the organisation that does it. Now, we know about the Serum Institute of India in Pune making the AstraZeneca Oxford vaccine. Good stuff, we know that one. But here's the other one. I didn't know about this one. This is Covaxin made by this bunch here. Now, I did check on it. So it's a very old-fashioned type of vaccine. It's just an inactivated... So basically what they've done is brewed up lots of coronaviruses on cell cultures, killed them, and they're injecting that. So this is how a vaccine was originally done, of course. It was just inactive, dead organisms. So going back to the first principles there, really. So interesting, inactivated form of the coronavirus. Makes perfect sense. Phase 1 and 2 is completed. I didn't realise this. Phase 3 began in November. So the Indian researchers are reporting no serious side effect, good antibody response. No data published that I could find yet on the T-cell response and other responses, but we assume they're keeping an eye on that. The Indians have done a mass vaccination drill, and their initial vaccination target is 300 million people. And I've done some teaching and stuff in India, and it kind of looks disorganised, but when they want to do stuff, they really can. So I am optimistic the Indians are going to vaccinate 300 million people pretty soon, which of course is wonderful news. Pakistan, not quite so enthusiastic. Pakistan, high population, 233 million. Polio not yet eradicated. There's all sorts of conspiracy theories and rubbish. Polio is just an evil disease. I've seen hundreds of people with it. You get it all over villages in India and poor parts of the world. Now eradicated in India, but still in Pakistan and Afghanistan, largely because of conspiracy theories and indeed violence against vaccination teams, which of course is an outrage against humanity. But that has happened. Now they're going the Chinese route, the Chinese CanSino trials. Now, this is an adenovirus vector, so it's an adenovirus, adenovirus 5. Phase 2 trials are published. From the Phase 2 trials, the efficacy and safety looks okay on Phase 2. The vaccine's rolling out on China before the Phase 3 data is confirmed. This is not the way we do it in the UK. It's not the way we do it in the US. It's not the way we do it in Europe. That's the way they've chose to do it in China. Big advantage though, one-time injection, fridge temperatures. And good level of volunteers, 13,000 people injected in Pakistan out of 18,000 volunteers. So interesting, that's the way they have gone. And no reason why that shouldn't be effective. But we don't have the phase 3 data, so we can't say definitively. But that's the way the Pakistani government has decided to go. And of course, it's not what we do on this channel, but we can't ignore the geopolitical factors that are behind that. We know that if you follow geopolitics, which I don't particularly, but I think everyone knows that Pakistan has been leaning eastward rather than westward recently. No serious side effects reported from the Chinese vaccine in the trial. Finish the trial and start distribution in March. So it looks like the Pakistani authorities are doing this properly. They're waiting for the phase 3 data, which is the same as we've done in the UK. So that is 100% legitimate. And if that shows that the CanSino vaccine is safe and efficacious, then I'm delighted. But at the moment, we don't have the phase 3 data, so we can't say. Right, also trialling in Russia, Mexico and Chile. That is the CanSino vaccine is being trialled in Chile, Mexico, Russia. So it's not just Pakistan. So it is appearing to roll out as an international vaccine. Oh, shall we have some pictures? Have we got some pictures? I think we've got some pictures. Have we got some pictures? Tell you what, I'll get my act together tomorrow and I'll give you some pictures. Okay, we'll leave it there for today. Thanks for watching. I think we've summarised where we are. Oh, look, it looks like Winston's taken his vitamin D. That's good. I'm glad to see you setting a good example. Personally, I am taking. I'm taking 2 of these a day. I'll show you on the other camera. 2 of those a day. No camera wants to show this. Let's try that one. So I'm taking 25 micrograms. Sorry, technology problems here. Anyway, I'm taking 25 micrograms tablets of vitamin D, and I'm taking 2 of those a day. Yeah, there you go. This one's from Asda. Other brands are available. So in other words, I'm taking 2,000 international units a day of vitamin D because there's no sunshine here. And when there is, it's too cold to go out. Good. Thank you for watching, as always.